negotiations. Iran, Russia and Turkey say they will jointly enforce a cessation of hostilities in Syria after peace talks in Astana. And China's asserted its indisputable sovereignty over parts of the South China Sea after the Trump administration said it would prevent China from taking territory.
It's 9:01.
KLEK LP Jonesboro, the voice of Arkansas Minority Advocacy Council. It's now time for Community Conversations, a program focusing on the people working to make the Jonesboro community a better place, while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK 102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
KLEK 102.5 FM. Good morning to you on your Tuesday. It's January 24th, 2017. This is Community Conversations. Kayla Wonder is in the studio with you along with my co-host, Mrs. Kabila Harden. And today our guest is Mr. Bruce Donaldson. He is the broker navigator outreach manager for the Arkansas Health Insurance Marketplace. He has more than 25 years of experience in employee benefits. He is the leading agent broker education efforts for Arkansas state-based small business health insurance options program, which is being offered under the My Arkansas Insurance brand. Mr. Donaldson is a certified health consultant with experience as a carrier representative and is an independent producer. He is a graduate of Queens College, New York. We are going to talk about the Arkansas Health Insurance Marketplace. It's called My Arkansas Insurance. This is the official marketplace for health insurance in the state of Arkansas. So, Bruce, how are you doing today, sir?
I'm doing great, sir. Thank you for having me on.
All right, well, Bruce, let's go ahead and get to it. Tell us a little bit about My Arkansas Insurance.
Well, the Arkansas Health Insurance Marketplace, that's where the consumers in Arkansas can go to obtain health care coverage on the individual or small group basis. Employers can go there as well.
Okay. All right, Bruce, so why do Arkansans need health insurance? Can you take a chance on just getting sick or injured?
I'm sorry, can hardly hear you, sir.
Okay. Why do Arkansans need health insurance? Can't you just take a chance on getting sick or injured?
The Arkansans that need health insurance, they have until next Tuesday, a week from today. That's when the open enrollment closes, and the ability to get a plan for 2017, that's the time you need to do that. Now, if you have coverage, it's also the time that you can change your plan to, let's say, from a silver to a gold plan, or you can change carriers. So after open enrollment closes on Tuesday, then you are on that plan until next open enrollment.
All right. Hi, Mr. Bruce. My name is Kabila.
Hi, how are you?
Okay, I just wanted to back up and ask a question. I don't think Leganzi was trying to ask, and I think more people would like to know, why do Arkansans need health insurance? Like, can they just take a chance on getting sick or injured?
Oh, no. And the insurance provides people access to health care, and that's so important because that's where you can get your preventive care, and by doing your yearly physicals, you can stop something big from happening down the road. So it's very important to have coverage, not only for the financial reasons, but also for health reasons, and we want all Arkansans to be healthy.
Okay. Well, thank you so much for that, sir. And then
Sure.
You talked about the marketplace. What benefits do plans on the marketplace cover?
Okay, they're very comprehensive. They call them the metallic plans or the ACA compliant plans, and they include benefits like preventive care, prescription drugs, outpatient care, emergency hospitalization, mental health and addiction care, lab tests, pediatric care. So it's a very comprehensive set of benefits.
Okay.
We are speaking with Bruce Donaldson with the My Arkansas Insurance. This is the official marketplace for health insurance. It is offered by the state of Arkansas, so we want to make sure that the listeners out there know kind of what we're talking about today. Bruce, now what is the deadline to enroll in health insurance for those who just tuning in?
Okay, so the deadline is a week from today, January 31st. We are in process of an open enrollment, so this is the time that people who are not covered can get health insurance. So they can go to myarinsurance.com, and they can click on the individual tab up on top and proceed from there. Or they can also get free there's a free local hotline open Monday through Saturday, 7 a.m. to 7 p.m., and the number is 1-844-355-3262. So those folks that don't have access to the internet or don't have a computer, they can call that number, and the number again is 844-355-3262, and they'll be able to get some help.
Okay. I'm looking through the list of all the various benefits that could be covered under the marketplace plans. What about pre-existing conditions? I'm sorry, I know this question is not on our list, but I just wanted to throw that out there concerning pre-existing conditions.
Right, and that's why we have an open enrollment, because these plans will not either restrict coverage for pre-existing conditions. So you can have a pre-existing conditions, you sign up, and you're covered from day one for all conditions. Okay. And that's why we have an open enrollment, and it prevents people from waiting until July when they get sick and they jump on a plan and jump off, and that wouldn't be insurance anymore. So the open enrollment period that we are now in the process of allows people to get on coverage and not have to worry about pre-existing conditions.
Okay.
Once again, we are speaking with Bruce Donaldson of the My Arkansas Insurance, the official marketplace for health insurance of the state of Arkansas. Bruce, if you currently have coverage for 2017, is it necessary to update your plan?
Yes, it's a pretty good idea that you do, only just to not only see what else is out there as far as different plans from different carriers. You could have some new benefits, but also that if you're getting help paying your premiums, like tax credits, and help in paying those premiums every month, it's really based on your income. So if let's say you had 2 jobs last year and you were getting some tax credits, but you quit one job and now your income is lower, you could actually be eligible for more tax credit, and vice versa. If your income goes up, you want to make sure you adjust that so that you get less tax credits, because at the end of the year there's an accounting and on your taxes, and if you got too much tax credits, they will ask for it back, and if you got too little tax credits, they will reimburse you for that.
Okay.
All right, so Bruce, what happens if you don't enroll in health insurance by January 31st?
Those that are not insured, they could face a potential tax penalty at the end of the year, and that can be pretty significant. It can be up to, it's really the greater of $695 per person, or 2.5% of your household income, so it can be substantial.
Oh, wow. And I don't want to get too political about this question, but it goes along with the one that was just asked. We know that there is some talk about changing the ACA under the new administration. Would this tax penalty still apply? I've been following the news very closely, as it does affect all of us, myself included, and there's a lot of talk about maybe removing the individual mandate. Again, that's all talk. Okay.
We here at the Arkansas Health Insurance Marketplace, we're going to wait and see what happens, and then we will take the ball from there and do whatever the new law says.
So a good rule of measure is just to go ahead and try to get in by January 31st, just to avoid any possible penalties.
Yes, ma'am, because it is still the law of the land, and who knows how long it may take to repeal that law.
Okay.
It can be done fast, and it may take another year. So you're better off getting on the plan, avoiding the tax penalty, but also having access to health care, which is very important for all Arkansans.
Yes, sir, it is.
Once again, we are speaking with Bruce Donaldson of My Arkansas Insurance, the official marketplace for health insurance for the state of Arkansas. We're talking about the various plans that are available in the marketplace that is offered by the state of Arkansas, and just general information about what the My Arkansas Insurance has to offer. Now, Bruce, what happens if you didn't have coverage in 2016? How would that apply to someone who may be in that situation?
I'm sorry, could you repeat that, please? I can hardly hear you.
Okay, what happens if you did not have coverage in 2016?
Okay, if you did not have coverage in 16, you could face tax penalty when you do your taxes for 16. And again, it's 2.5% of your household income, or up to $695. It's the greater of those two. So there is still a fee that would apply to you if you did not have health care coverage last year.
All right, so let's move forward, because we don't want anyone to incur any fees or anything like that. So how can Arkansans enroll in health insurance? If there's someone out there that is looking for health insurance and they want to go on the Arkansas marketplace that is offered by the state, how can they do so? How can they enroll?
Okay, so if they're good on the computer, and a lot of, especially the young folks are, they can go on the myarinsurance.com and they can start that process. But there is help out there for anyone who, if they want to get help and they want somebody else to help them through that process. There's a lot of terminology, and health insurance is a complex product. And so if they want some in-person help, we have licensed agents and brokers out there, and we have assisters, navigators, IPA guides. We have all kinds of people that are licensed to sell marketplace plans to consumers in Arkansas. And you simply can go to the myarinsurance.com and you can do a search feature. You put in your zip code and up pops all the names of the people that are close to you that can come and help you either over the phone or in person. Or you can call that toll number 844-355-3262 and they can help you find somebody local to you if you don't have a computer.
Okay, well, thank you so much. Another question, so concerning getting coverage for 2017, if someone doesn't sign up by the deadline, can they still get coverage?
Well, the only way you can get coverage through the course of the year after open enrollment closes is if they qualify for a special enrollment period. And you can qualify for that, such as examples is like, let's say you lost your group insurance coverage. You quit your job or you got laid off or whatever, you lost group insurance, you have the opportunity to go on the marketplace. Getting married, having a baby, or you turn 26 and you can't stay on your parents' plan anymore, you can now, throughout the course of the year, get coverage on the marketplace. But please remember that you have 60 days to get that coverage, otherwise then you will get closed out.
Okay. I did want to back up because I had one, well, I guess this will go into, I'll ask that question after the next one, about can you get help with the monthly cost?
Yes, and that's through tax credits. So what you do is you go online and you do the enrollment. You set up your account. You tell them who you are, your social security number, all your dependent information if you have any, and then you put in your income. And so this is based on income only. It's not asset tested. It's income only. And then based on your income, you're going to, if you're like, let's say, under 400% of federal poverty level, then you're going to get help. If you're over 400% of poverty level, then you will pay the entire premium yourself. So it really is gauged on your household income.
Okay, well, since we're talking about income, I do want to ask, say someone falls below whatever the income level is and they fall into the poverty level, would they then be advised maybe to try to apply for Medicaid or Medicare or something of that nature?
Yes, and those folks that fall, it's the 138% level. So if they fall below 138%, let me give you an idea. A single person making less than $16,394 a year falls into that. So if they make less than $16,000, they're eligible for the Medicaid expansion, which we call Arkansas Works. If, let's say for a family of four, if that household income falls below $33,534, they are eligible for Arkansas Works. And Arkansas Works is really being poor or becoming poor is open enrollment all year. So people that fall into that category can enroll into Arkansas Works at any time during the course of the year. They pay very little or no premium, and they also have full benefits. But they need to enroll.
Okay. Now, what about individuals with disabilities, but they still make a certain amount of income? It may be a disability. I don't know. I hate to say they're still able to work. They're not able to work, but they still have some income from other resources coming in. Are they?
Yeah, they fall into, if they're below 138%, again, they fall into Arkansas Works,
Okay.
and they can get coverage there. If their income is above that, then they are eligible for marketplace plans like anybody else.
Okay.
They are not discriminated because they have a disability.
Okay. Alrighty, so are there any other topics we didn't cover that you would like the people to know concerning, health insurance is such a tricky thing to navigate. There's so much terminology, as you mentioned before. People can easily get tripped up and get confused and they might end up picking the wrong plan based on their needs. So again, can you advise people on...
Yes, and that is very much a reality that the health insurance plans, they're a complex product. There's a lot of terminology like deductibles, copay, co-insurance, provider network, drug tiers, this, that, and the other. And if they're not well versed in that terminology, I would highly recommend them make a phone call or go on the computer, get some help. The brokers and agents and navigators that I'm speaking about can help you. They're free of charge. They're not allowed to charge you anything. So you can get free professional advice and help in navigating the myriad acronyms and deductibles and this and that and the other. I mean, you can get really good help, and rest assured that you did the right choice with the right advice.
All right, and so again, to give people the phone number, it is 1-844-355-3262, and this hotline is open Monday through Saturday, 7 a.m. to 7 p.m. Or like Mr. Bruce said, if you are good on the computers, go to myarinsurance.com and you can explore their various plans, and I'm sure you can look at the different terminology to help you navigate the system to pick the right plan for you.
All right, once again, we are speaking with Mr. Bruce Donaldson of the My Arkansas Insurance, the official marketplace for health insurance. Just going to give some information about the health insurance marketplace, which is offered by the state of Arkansas. So January 31st is the deadline, so make sure that you are enrolled in insurance, because we don't know what the future may hold. So you want to be on the safe side to make sure that you're covered no matter what may take place. So once again, we want to thank Mr. Donaldson for stopping in. Any final words?
Well, thank you for having me on and helping to get the word out there that Arkansans do need to have coverage. We don't know where the law is going to take us, but for right now, it is a law of the land, and so hopefully they can get coverage, get healthy, and stay healthy, and let's look forward to the next year.
All right, once again, thank you, Mr. Donaldson, for calling in. Don't forget, coming up in a few minutes, we're going to have Craighead County District Judge David Bowling. He is on his way to the studio. We're going to go ahead and get ready to go into a break, but we'll be back with more of Community Conversations. This is KLEK 102.5 FM.